Good morning, everybody, and welcome to the 10th Annual Hicks Ferguson Multiple Myeloma Symposium. We are so grateful for your participation today and our ability to reconnect with you virtually after having to cancel our 2020 symposium due to the COVID pandemic. My name is Clark Kellogg, and I will be your MC for today's symposium. What an honor and blessing and privilege it is for me to be part of such a wonderful initiative focusing on multiple myeloma and the minority community. My dad died in 2016 from complications due to gallbladder surgery, but in 2008, he was diagnosed with multiple myeloma. And thanks to great medical care, he was able to actually live quite normally until his battle with a faulty surgery in the spring of 2016. The symposium will focus on advocacy, caregiving, new medical trends, and health and nutrition. We have some dynamic presenters today from across the country ready to share their expertise and resources with you. Please welcome now Reverend Dr. Eugene Gibson, Senior Pastor of Mount Olivet Baptist Church in Columbus, Ohio, for our opening prayer.
Thank you, Clark, for such a wonderful and gracious introduction. And greetings to all of you that are here at the HHFMM Virtual Symposium. Thank you for the leadership for allowing me to be here today. Again, my name is Dr. Eugene Gibson. I'm the Senior Pastor of the Mount Olivet Baptist Church here in Columbus. Shall we pray? And God, we stop and simply say thank you for this gathering. We thank you for you being our God from whatever faith tradition we come from. We thank you, God, that we are here simply because of love. We're simply here because of survival. We're simply here so that we might honor those that have gone before us. Thank you, God, for the leadership of this symposium. Thank you for the doctors. Thank you for the survivors. And thank you even for the memory of those that have left us. We praise you now for the gift of medicine, and we praise you now for the gift of life. Now, God, we ask that you superintend this night and that you would bless everyone that is here, that our hearts and our heads would be lifted and that you would get glory. For it's in the name of the one who makes all we do possible, Jesus the Christ, we pray. Amen.
Thank you, Reverend Dr. Gibson, for that wonderfully inspirational blessing over our symposium. Now, before we begin, a few housekeeping items as part of my job as MC. We encourage you to use the chat box to make comments about the program, presenters, and request more information or anything else you feel like we might need to hear from you about. Use the chat box. We will try to answer any questions during the program. However, if your question is not answered, responses will be posted to our website after the program. The Symposium Planning Committee will be having chat raffles throughout today's program, giving away various gift cards. These chat raffles will be randomly drawn from those registered and actively participating in the symposium by the committee, and winners will be announced via the chat box and through the email provided at registration. Last but not least, we will continue our practice of raffling off a beautiful, spiritual messaged multiple myeloma quilt today that will be given to one of our participants at the conclusion of this event. So join me now in watching this short video about the multiple myeloma quilt to see what you have to do to win this very special handmade quilt.
My name is Myrtle Groves, and I go to Trinity Baptist Church. I've been a member here about all my life. First, I became a nurse, and after that, I was a quilter, and I love it.
My name is Marilyn Zimmerman. I am a retired Columbus City school teacher and a multiple myeloma survivor, which I am celebrating my 10th year anniversary this month. One of the things that I would say helped me was family and friends and prayers.
The reason why I got into quilting because of my friends and family here at the church. My mom, she loved Christmas, and I got on my Christmas quilt some different little items that she loved. And my colors, I got those from friends here at church in my quilting class.
I started doing the multiple myeloma quilts for the Hicks Ferguson Symposium about 4 years ago. I do the piecing, and then Norma Dixon in Cleveland does the machine quilt. So you would select your fabrics, but you would not know what it's going to look like. We would go down to Chillicothe and create the design, and they would have people who would iron everything for us and clip everything. But what is wonderful about this quilt is how Norma put the words love, courage, family, hope, perseverance. Although this quilt, I put a lot of love in, this quilt will be given to a person who completes the evaluation. Your name will go into a drawing for the quilt, but you must complete the evaluation. Put yourself in an opportunity to win.
After that video, I'm sure all of you are out there thinking the same thing I am. I want that beautiful quilt. The craftsmanship and the love put into this quilt by HHF committee member Marilyn Zimmerman is greatly appreciated. So if you want a chance to win the multiple myeloma quilt, please do not forget to complete the short symposium evaluation that will automatically launch after the event to the email that you used to register. One winner will be randomly selected once all evaluations are received and verified. That winner will be notified no later than October 29th, 2021 by email or phone. And now, without further ado, let's move on to our opening remarks. First, we have Ms. Joanne Harris, HHF Planning Committee Chair, followed by Ronald Browder, President, CEO of the Ohio Federation for Health Equity and Social Justice, and then a representative from our gold partner, Amgen.
Good morning. On behalf of the Hicks-Harris-Ferguson Planning Committee, we bring you greetings and thank you for joining us for our 10th annual Hicks-Harris-Ferguson Multiple Myeloma Symposium. We give thanks to our founder, Cheryl Boyce, for her vision to create a greater awareness for those suffering with this illness. It is our hope that you will enjoy the symposium today as you become enlightened about new technology, new treatment, and encouragement as you continue the fight. We pray God's blessings upon you as we begin the Hicks-Harris-Ferguson Symposium. Please welcome Ronald Browder.
Good morning. On behalf of the Ohio Federation for Health Equity and Social Justice, I want to say that this 10th annual Hicks-Harris-Ferguson Symposium is one of the most exciting events we have ever presented. We hope the valuable information that is shared today will help inspire you to join us in this effort to bring awareness and eventual cure to multiple myeloma. Thank you for joining us today on this journey. Up next is our Amgen representative.
Hi, I'm Steve Marmaris, Senior Manager, Advocacy Relations at Amgen. On behalf of the Ohio Federation for Health Equity and Social Justice and Amgen, I'd like to welcome you and thank you for your continued support and participation in this symposium. Since Amgen's founding 40 years ago as one of the first biotech startups of the biotech revolution, we have grown into one of the largest independent biotech companies in the world. Our world-class scientists lead the field in discovering novel ways to treat serious diseases, and some of the world's greatest scientific advances are happening now inside Amgen. While we are very proud of the significant strides we've made to date in the area of clinical trial diversity, we know we have a long road ahead. We look forward to continuing to focus on breaking down barriers and increasing participation in clinical trials among historically underrepresented communities. As we look into our pipeline, we will focus in disease areas that disproportionately affect racial and ethnic minorities, including cancers such as colon, prostate, lung, triple-negative breast cancer, and of course, multiple myeloma. We are allies you can count on. On behalf of Amgen, I would like to thank you for your time and attention, and please enjoy the rest of this terrific symposium.
Thank you so much, Joanne, Ron, and Amgen, not just for your remarks, but for your commitment, your loyalty, your passion, and your support. As we celebrate this 10th annual event, which started in 2011, thanks to the commitment and passion of the late Cheryl Boyce, who also had multiple myeloma and felt compelled to put a face and name on this disease. Let's now take a look back at the history of Hicks Harris Ferguson over the last 10 years with Jerome Ferguson, Planning Committee Vice Chair, narrating.
Greetings. My name is Jerome Ferguson. Several years ago, the late Cheryl Boyce, a multiple myeloma patient herself, had a conversation with her oncologist, Dr. William Hicks, about her surprise at so few African American patients in various treatment settings, in spite of disproportionate incidence of the disease in our community. He agreed, and that conversation led to the creation of the symposium. So often, when people talk about multiple myeloma, they cite numbers, but they are real people who live, work, and play in our community. Their loss represents the loss of loved ones, productive and vital members of our community. This symposium series is named in honor of 3 beloved members of our community who fought the good fight against this disease. They are Miss Eleanor Hicks. She was a mother, an educator in Columbus Public Schools for more than 20 years, and the First Lady of Mount Olivet Baptist Church, the wife of Reverend Dr. H. Beecher Hicks Sr., a nationally regarded pastor. Miss Hicks was known throughout the community as a woman who possessed rare gifts of intellect and grace. Reverend Richard Harris. Reverend Harris was a native of Chillicothe. He served in the United States Air Force from 1960 through 65. During his enlistment, he met and married Joanne Harris. Richard was called into the ministry in 1982 and became an itinerant elder in the African Methodist Episcopal Church in 1988. He served with honor and dignity as pastor of St. Paul AME Zanesville, Ohio for 10 years, and St. Mark AME Church, Columbus, Ohio, until his death. Miss Lugenia Pierman Ferguson. Miss Ferguson lived a life of service. Trained as a nurse, she worked to improve the health of others. Miss Ferguson was a Renaissance woman. Her beautiful voice afforded her the opportunity to sing with Count Basie, Dizzy Gillespie, and Sonny Stitt. She was a committed missionary and served as the chairperson of the Ohio Council of Churches Commission on the Age. The lives of these 3 remarkable people intersected at multiple myeloma, lending a real face to this disease. I'm proud to say that Lugenia Ferguson was my mother. With support from friends and members of the Hicks Harris Ferguson families, along with sponsorship for more multiple myeloma opportunities for research and education, the first symposium was held in September 2011 in Columbus, Ohio. The symposium was designed to reach the African American community with information and education about multiple myeloma. Let's take a look back at our journey over the last 10 years. The first few years, 2011 through 2014, the symposium focused on awareness and education, using local physicians and professionals, such as our own Dr. William J. Hicks, Dr. Craig Hoffmeister, and Dr. Yvonne Efferberry, both formerly of the OSU Comprehensive Cancer Center, to share new treatments and medical updates. Other sessions conducted were oral health, financial assistance, and caregiver resources. We were honored in 2014 to have the late Reverend Dr. Charles E. Booth, Mount Olivet Baptist Church, located in Columbus, Ohio, who shared his diagnosis and journey with multiple myeloma. The following few years, 2015 through 2017, our presenters expanded to nationally recognized medical professionals who focused primarily on new treatments, race in multiple myeloma, and research efforts for a cure for this disease. These presenters have been Emmett Craig Cole, MD, from Michigan State University, Raquel Ennis Shelton, MD, Alabama Oncology. Included were sessions on nutrition, pain management, and exercise. In 2016, Moore ceased operations, and Ohio Federation for Health Equity and Social Justice assumed fiduciary responsibility for Hicks Harris Ferguson. The last couple of years, 2018 and 2019, the focus has been on new medical treatments, clinical trials, and updates in research. Our presenters were Yvonne A. Efferbarrel, MD, formerly of the Ohio State Comprehensive Cancer Center, and Melanie Smith, MD, at the Memorial Sloan Kettering Cancer Center. Our breakout sessions focused on caregivers, self-advocacy, skin care, and medical and financial resources. In 2020, we had to postpone our event due to the COVID pandemic and provided a series of webinars on advocacy, myeloma 101, and new trends, and a healthy cooking demonstration to help keep our audience engaged. The work continues to evolve, and Hicks Harris Ferguson is positioned to ensure that those newly and currently diagnosed have the information to aid in their survival with this disease. We thank you for joining us today for our 10th annual celebration.
Wow, that was absolutely fantastic. What a testimony to the care and commitment of so many. You know, the work that this committee has done over the last 10 years is absolutely amazing. So many lives have been touched by the information and resources shared at this event. Again, what an honor to be standing here amongst individuals that saw community need, found ways to address it, and bring not just local, but national attention to this disease. And although much has been accomplished, there is still a lot more to be done to find a cure for multiple myeloma. With that said, this work could not be completed without the hard work of the Planning Committee. Again, a big thank you to the committee for all that you do and continue to do and achieve on behalf of those diagnosed and living with multiple myeloma. Now for our opening session, a conversation with Rod Gilmore. I had the distinct pleasure and privilege to sit down with Rod prior to this symposium to discuss his personal battle with multiple myeloma, along with sharing my indirect connection to the disease through my dad's diagnosis in 2008. Let's now take a look back at my conversation with Rod Gilmore. Well, Rod, great to see you, and I really appreciate you carving out some time to share your story here at the Hicks Harris Ferguson Multiple Myeloma Symposium. Welcome.
Hey, Clark, it's great to be here. Listen, I was hoping to be a part of this last year. Partnered with Amgen to help spread the word about multiple myeloma, and I was disappointed that it got canceled last year because of the pandemic. So I'm really happy to be a part of it this year.
Well, we're obviously going to get into your story about living with multiple myeloma, but I first want to hear about how you found yourself in the broadcasting studio after playing football and baseball at Stanford, and then starting your law career after going to law school when you completed your undergrad work.
Yeah, it wasn't planned. It really wasn't. I had finished up law school. I was a practicing lawyer, and when I had gone to law school, the thought was getting into professional sports, as a lawyer with the league or with a team, and that's very, very difficult, and it just never happened. And so I was just trying to stay close to the game any way that I could, and I was helping a friend out who had a radio show in San Francisco, and he had me come on every couple of weeks or so to talk about sports and law, which I enjoyed doing. And then he had an opportunity to do some local college baseball and small college football games. And he asked me to join him. And I did. And from there, I got a shot to do some local games and then regional games involving West Coast teams, Stanford, California, and the like. And I got a shot to join a network out of LA that was doing games up and down the coast. And lo and behold, a couple years later, I got a call from ESPN asking me if I wanted to interview with them and audition. And that was 1996, and I've been there ever since.
Wow, how about that?
It was not planned.
Well, sometimes our best paths are not planned. And you mentioned the baseball part of your background. You actually played baseball in college as well, right, at Stanford?
Oh, yeah. Listen, I grew up playing baseball with some of the all-time greats. And, you know, I was silly enough to think that I was going to be an all-time great in baseball. But I played as a teenager and in high school with Ricky Henderson. We played on the same summer league teams and played against each other in high school. Wow. Been friends forever. A good friend of mine, Gary Pettis, is a third base coach for the Houston Astros. Same scenario. We played together in summer leagues and played against each other in high school, and any number of other former pro players, Lloyd Mosby and others. So we had a pretty good team. We had some guys that went on to play pro ball, and a lot of us either played in the minors or played college ball. And I played at Stanford until football led me to tear up a shoulder one season, and that sort of ended my baseball career.
Well, you've had a nice journey since your athletic career, and let's now delve into the primary reason we're gathered at this symposium is to talk about your lived experience with multiple myeloma. If you could kind of walk us through your when the diagnosis happened and where you are today, some of the highlights and maybe challenges from that point of being diagnosed to where you are today.
Yeah, you know, it's weird. Every time I think about it, it's like it happened yesterday. But I was diagnosed in 2016. My diagnosis was discovered through an annual physical. It was indicated by a blood test, and I actually was planning a business trip. I got a call from my doctor. And he said, "Hey, I got your results and you should come in and chat." And I said, "Well, I'll be back in a week and a half or so. I'm leaving on a trip." He said, "Nah, I think we should talk today. Don't take the trip. Come see me." Mm-hmm. I figured that was not good news. And so when he told me in his office that I had multiple myeloma, I started nodding my head and I'm thinking, okay, all right. So what do we do? And he said, "Well, I can't help you with this." And I said, well, why not? And I figured it was, you know, I was anemic or something like that. And he said, "No, multiple myeloma is a blood cancer. I can't help you with that. We have to find you a specialist." And I was stunned. The word cancer just kind of rings in your head. And I was shocked. I didn't know what it meant. I had never heard of multiple myeloma. And immediately I started thinking, all right, what do I do? How do I address this? How do I tell my family, my wife, my kids, what's the next step? How do I find out information? Who treats me? It's just overwhelming when you hear that. And so it was incredibly shocking. And it takes a little bit to try to figure out how you want to go. And I had the prior experience, and you know, you're familiar with this from your own experience. I lost my dad almost 15 years ago to cancer, and it was a different form of cancer, but mm-hmm. I knew the impact that it had on my family, and I knew how much it would hurt my mother to think that she was going to go through this again with her son. So all of these things, you know, are going through my head. And the first thing I got to try and figure out is, you know, what to do. And I can't emphasize enough how, you know, it's overwhelming and somewhat paralyzing. And, you know, my first reaction, like a lot of my friends, a lot of men in particular, is I can figure this out. I'll figure out where to go and what to do and what not. Mm-hmm. And it doesn't work that way. I mean, you mm-hmm. really need to find help and to have a team behind you. And I learned that very quickly, because as I tried to figure out what multiple myeloma is and how you get treated for it, it became very clear to me that I couldn't do it by myself. I needed to find a team to help me figure out all these questions that I had and how to get started on that journey.
Wow, that takes me back a little bit to when my dad told me that he had been diagnosed in 2008, the winter of 2008. He was diagnosed with multiple myeloma. And the same kind of reaction that you just described is kind of how he felt. Where do I go? What's next? Cancer. I haven't heard of this. No symptoms really. And regular checkup, blood work. Something looks a little out of place, not quite right. And then you do further investigation and that diagnosis is given. And then you step into what's next, the what ifs. And at some point, when did you kind of sense or feel that the overwhelming nature of it subsided? I know it never goes away, but when did you start to sense, and what, actually a different question is, what were the things that allowed you to begin to think about how am I going to move forward?
Yeah, first of all, your experience is a prime example of, when someone in your family gets cancer, it impacts everyone. And I think that gets overlooked and the focus tends to go on the person who has cancer. But, it really does impact the lives of the people close to you. There's no question about that. For me, that sense of being overwhelmed didn't go away initially. I felt better about things after I could see that we were starting to understand some things. It required me to quit thinking that I could handle it by myself. And to be perfectly honest, my wife stepped in and said, okay, here's what we're going to do first. And by calling friends and relying on people who, had some expertise in the area, could explain to us what we were dealing with, we were able to find the right place for the right oncologist, for me, and to get a team together of people who could help me manage this, from friends and family members to my wife to being connected to multiple myeloma patients that could help me understand what this journey was all about. Because it really is sort of like learning another language when you try to figure out what multiple myeloma is and how to address it, or drinking from a fire hose, any of those analogies. It's just difficult and overwhelming. And once you come to realize that you can't do it by yourself and that you need a team to help you manage the process, you're so much better off. And you have to have a plan as to how you're going to go about this. And everybody's different. I had a plan created that works for me. As we know about multiple myeloma, it is so different. There's so many different subtypes that not everybody has the same journey or the same treatment. And so everybody needs a different kind of plan that works for them going forward. And once we figured that out, we got that kind of squared away. And that helped me kind of get comfortable with, okay, this is the direction that we're going in and what we're going to do.
Yeah, it's interesting. You drum up some memories as my dad was going through his own battle with multiple myeloma, and how the shock, the overwhelming nature doesn't go away, but with the help of a team that can help create a plan, and then you begin the process of treatment, executing the plan. And I recall, to your point around the different ways this cancer affects different people, is that the treatment plans sometimes have to be tweaked or nuanced. Without getting into specifics, that's exactly what went on with my dad. But ultimately, through that teamwork and that plan, they got to a place where he found some stability and really had some pretty good periods from his diagnosis in 2008 until ultimately his death in 2016. He had some periods where the combination of team, plan, and treatment actually allowed him to enjoy a pretty good quality of life for probably, I would say 6.5 of those 8 years. And while the loss in 2016 was still devastating, the fact that he actually did pretty well was a good positive to memory for us. So if you could just kind of talk about the importance of that plan and that team. I've heard you talk a little bit about what an MVP type of approach. Could you share that with our listeners?
Yeah, you brought this up. I was talking about your dad. The nature of multiple myeloma is that you have these periods of remission and periods of relapse. That's just the nature of the disease. One of the things that I decided early on was that I wasn't going to ride that roller coaster. I just accepted that, remission and relapse is going to happen. I'm thinking big picture and what I can control. And my attitude and my approach is just going to be steady. And I'm not going to emotionally go up and down based on any results on a weekly or a monthly, basis, because it's just the nature of the disease. You will have remissions and you will have relapses. So that was important to me. I think the other thing that I figured out, and I would encourage others to think about when you think about having a plan and having a team work with you, is just that you have to be honest. You have to be honest with yourself. You have to be honest with your doctor and the people around you. I'll give you a couple of examples. I had to be honest with myself about what is it that I really cared about that I wanted to do. And it was important to me that I continue to work at as high a level as I could. It was also important to me that I keep up a very robust exercise routine. And I told my doctor that. I said, these are things I want to do. How can I do it? Are you telling me now that I have multiple myeloma, I can no longer exercise? And he said, no, we'll figure out a way for you to do that. And so we did. Another example is, people care, when you tell them that you're sick, and people want to be there. They want to help you. They're stronger than or you think when you share this information, but it can be overwhelming to have so many phone calls, text messages, emails early on when you're trying to figure out things. And my wife took charge of it. She took charge of my phone and everything through the first 2 or 3 weeks. And she told people, listen, I'm going to send out an email weekly to all of you to let you know what's going on. Don't bother to text or call him for this next 2 weeks, whatever, because he doesn't have his phone. We're getting things squared away. And once we get through this period, you'll be able to reach him again. But I'm controlling things for right now. And having that respite and not having to respond to everybody all day long, saved my energy, saved my focus, and it was the right thing. It's not this thing that lasted forever, but at certain times when there are things going on, the last thing you really have the energy for is trying to talk to and explain to everybody, family members, friends, colleagues, what's going on. So it was really helpful to have someone step in and take charge of it and say, he's fine. I'll give you an update. Don't worry that he's not responding to you now. I got it for the next few days or so.
Yeah. Hey, I want to go back a couple of points you made that I just want to touch on. One is that at some point you got to a place where you were thinking about, what am I going to prioritize now that I have this diagnosis? What is it that I'd like to continue to do? You talked about wanting to continue to work, wanting to stay physically active. You also talked about being somewhat asymptomatic after you, in terms of the diagnosis and so forth. That being said, how has COVID impacted your experience in living with multiple myeloma?
Yeah, that's a great question because it's been a doozy. When you have multiple myeloma, you are immunocompromised. So you are at more risk than the average person. And so for much of last year, before the vaccine came on the scene, it meant that I had to be quarantined. I mean, there was no putting on a mask and running down to the grocery store. There was no putting on the mask and, going to see my, 90-year-old mom. It was too risky for me, too risky for her. So, that was a challenge. And I know that had to be a challenge for a lot of other cancer patients. And I, like a lot of other patients, cut back on, visits on the medical front, to see the dentist or, other things like that. And one of the things that the pandemic did was it exposed, some of the problems that we have, with healthcare, and particularly when people don't stay on top of their routines. A lot of people, stop going to get their regular screenings and checks, and that made them more at risk for not catching things early and having things detected. So that was a problem. The mental toll that it's taken on a lot of us got relieved a little bit when the vaccine came on the scene, because now it's a little bit easier to get out and to do some things. But I think one of the things that we learned, or I think a lot of us learned about the pandemic, is that, we can do hard things, as a people, as a country, when we have a sense of urgency. And we had that urgency for dealing with COVID and got a vaccine created in 9 months or so, whatever it was, record time. And in my view, that sense of urgency, we need to have that with cancer. I personally consider cancer a pandemic. 10 million people a year die from cancer. Almost all of us are touched by cancer in some way, shape, or form. And I think we're doing so well with research, and we're so close on so many fronts, that if we have that same sense of urgency for cancer and for multiple myeloma, we can really come up with some great treatments, and we could possibly save an awful lot of lives for people who are, waiting and surviving with multiple myeloma or with other cancers.
Well, that kind of segues for me, Rod, into my next question. Obviously, you've been an advocate, a spokesperson through your partnership with Amgen. You serve on the board of the Multiple Myeloma Research Foundation. Obviously, you've done an amazing job of becoming educated and also spreading that education and information to others as an advocate, raising awareness. How prevalent is multiple myeloma? Tell us a little bit about who it affects, how it affects them, if you will.
Yeah, it's not a well-known blood cancer, but it's weird. Once you know someone with multiple myeloma, and I know that you've had this experience, you can't help running into people who are connected with it. About 35,000 people a year are diagnosed with multiple myeloma. I was shocked to find out when I was diagnosed that it impacts and hits African Americans twice as often as white Americans. I had no idea. And I know from my own experience that it's just not very well known in the Black community. And that was one of the things that, motivated me to become involved and to partner with Amgen in trying to spread the word. Serendipity, if you like. Amgen was looking to do that to help spread the word. And I felt from, maybe a couple of weeks or so after I was diagnosed, I felt like, this can't simply be about me, having multiple myeloma. I could see the impact it was having on my family and folks around me, and the focus just couldn't be on me. It had to be greater than that. It had to be something that was a cause, that I was part of. And for me, that cause has been spreading the word about it and making more people aware of it, and hopefully generating enough concern and awareness that we push forward with treatments and we find a cure. Because right now there is no cure. There are some excellent treatments that have come down the path in the last 10 years or so. We need more of them. And I personally think that we're not that far away, and hopefully we can get more of a focus and a push and some urgency on it.
Yeah, well said. You travel pretty much weekly for your work, much like I do as a college basketball analyst. Multiple myeloma is a cancer, and you're living with that. There's a COVID pandemic taking place. Did you miss any assignments? Did you have to did you not travel at times because of your condition and COVID? How did you kind of navigate that during your busiest season, which you're just starting to be busy now? But in the past years, how is that, the last 2 years anyway, how has that kind of played out for you on the work side?
Yeah, well, I'm fortunate to be able to say that since 2016, my routine hasn't changed. I've really not missed any work on any front. But everybody's different. Every subtype of multiple myeloma is different. I've been fortunate in the sense that my routine has worked for me, and I've been able to maintain kind of a normal lifestyle. I will share with you that before the pandemic, from 2016, on, I was the guy in the airport. I was the guy on the plane with the big mask on and the like, and everybody was looking at me going, what is wrong with this guy? And now I'm just one of many, one of everybody who wears a mask. So it's sort of weird to see that, how I was getting all the strange looks for years, and now I just blend in with everybody else with my mask. So it's
well, that's amazing.
It's one of these things.
Amazing that you've been able to continue to do your job and not have any major setbacks in terms of your ability to do something that you set out to be able to do. So you've had that's just remarkable, and a testament, I think, to a number of things, probably.
Well, Clark, part of that though goes back to the whole issue of team. That wouldn't happen without my colleagues and friends helping out, picking up some work for me when I needed some assistance, if I didn't have the energy or needed, a break for, a day or so, having my schedule tweaked. So maybe instead of traveling to the East Coast, I traveled down to Southern California. It really does take a team, and having people you trust that are involved with it that can help you figure out, how do I make this work? And that's what I mean by, having a plan and having a team, because these things are important to you. You simply can't just do them on your own and say, I'm going to make it happen. I'm not going to miss any work. There are people that you have to trust and can be involved to help you do that.
Well, you've touched on so many practical things that folks living with multiple myeloma can apply, whether they actually have been diagnosed with the disease themselves or they have a family member who has been diagnosed with multiple myeloma. I want to get you out of here on this. Is there anything that you would like to add in offering to those that are in our viewing audience around either statistics, data, personal notes that would close our conversation out?
Yeah, first of all, I think this symposium is a great platform for sharing information and for motivating people to help us address multiple myeloma. I would also say that we have a real problem with disparity in healthcare And on the multiple myeloma front, we struggle to get Black patients involved with clinicals and the like. And we need to have more of that so that we can have better outcomes for everyone. And, we know this disease hits African Americans more than it hits, white Americans. And we need to be a part of these clinicals, these trials, so that the right treatments, can be created. And then I think, as I mentioned earlier, the pandemic taught us some things, and we need to redouble our efforts and have some urgency about cancer and about multiple myeloma and how we address it. And, for patients or those who are caregivers to patients, I would just remind them that, it is a journey. It is a roller coaster with, relapses and remissions, and that, you shouldn't try and do it all by yourself. You got to have a team in place. You got to have a plan, and you have to be honest about what you want to do and what you need. And I think those are the points that I would like to continue to emphasize along with annual checkups, because those things will really, really help you give yourself a fighting chance.
Rod, I can't thank you enough on giving us some time and sharing with us your story, your journey, and offering some really helpful, practical pieces of advice. And just really appreciate your time, your person, your advocacy, and your passion for raising the awareness around multiple myeloma. So thank you so much. Great to have a chance to visit with you, and wishing you the very best this football season and in your continuing journey to live well through multiple myeloma.
Clark, thanks for having me. Thanks for having me at the symposium, and thank you for being part of the team dealing with multiple myeloma.
My pleasure. Thank you much. Just a short reminder here, please make sure you are watching the chat box to see if you are one of the lucky raffle winners. Next up on our agenda is the Caregiver panel, Through Their Eyes, moderated by Mrs. Kimberly Alexander. She will be having a personal conversation with family members who are currently caring for loved ones coping and living with multiple myeloma. Please welcome Kimberly and her guests.
Thank you for the introduction, Clark, and thank you to the HHF Planning Committee for allowing me to moderate this panel. I'm so excited to be here with Jean, who is a myeloma caregiver, and Christian, who is the daughter of a myeloma patient. I'm hoping that in hearing their stories and what they have to share, we can help others who are in the same position. Jean, let's introduce you first. You are a caregiver. You were are a caregiver for your husband, Stan. Can you give us a little backstory on how you originally found out about myeloma and your experience?
Kimberly, it's an honor to be on this panel with you and Christian. Our story is pretty interesting, but it may be typical. My husband has some other underlying conditions, and he was seeing a cardiologist. His cardiologist retired. We had to see a new cardiologist. And to make a long story even longer, with the new cardiologist, he did a workup on Stan. Stan had been having some anemia, but seeing his primary care physician, the primary care physician could not come up with what was the cause of the anemia. There was no internal bleeding. There had been upper GI, lower GI, all kinds of tests. And but the new cardiologist in his workup was concerned when he did the EKG. He was concerned when he did the stress test, and then he finally did a blood test. And when that blood test was done, Stan was still working at that time. He's retired now. When that blood test, the results of that blood test came back, we got a call that said, immediately report to the hospital. Go to the emergency room right now. Why? Just go. I can't reach your husband. You need to reach him. He needs to go to the hospital. So we got the diagnosis in the emergency room. And as you might think, we were pretty shocked with that diagnosis. Thankfully, though, Kimberly, it'll be 5 years in December. And we are grateful for these 5 years.
Absolutely. No, I totally understand. And there's something interesting about your story that you left out, and I want to make sure that I bring it up in a little bit because it's very different from most people that I encounter that have had an experience with myeloma. But I want to introduce Christian right quick and have her share her perspective because I think it's really interesting. Christian and I are connected because I know her mom, who is a myeloma patient. And when I spoke with her mother Tiffany, she thought it'd be important to include the perspective of an older child that is going through having to deal with the diagnosis of a parent, something that I had never really thought of. But in light of my conversation with her, I think it really is valid. Christian, can you give us some backstory on how it was that you came about learning about myeloma and your experience in dealing with your mother's diagnosis?
Yes, absolutely. So thank you all for having me be a part of this panel. I do appreciate it. So I was actually away at school when my mom was diagnosed. I was one of the last people in the family to know about the diagnosis because they waited until I came home for one of our school breaks to tell me what was going on. And I've never heard of multiple myeloma prior to her diagnosis. And to be honest, when I was first told, when they sat me down and told me, I don't think I even remembered what kind of cancer she had. Mm-hmm. And I at that time, it really didn't matter. The word cancer was all I heard. So over the years is how I've gained knowledge about multiple myeloma, but this was definitely my first time ever hearing of this kind of cancer. And I'm grateful that they waited until I was home to tell me about her diagnosis because it was great to have the support system and my family there around me when I did hear about it. But it's the hearing about multiple myeloma has been a journey, and learning about it has been a journey.
Mm-hmm. Well, thank you so much for sharing that. And that is the one point that I wanted to make sure that I brought up, because like you, I had never heard of multiple myeloma until my husband was diagnosed with it in 2005. Just remember, as soon as the doctor said it was cancer, I immediately thought, okay, they're going to cut it out. They'll have radiation. It's no big deal. And so, Jean, that is the point I wanted to get your perspective on, because you were not new to myeloma when you found out about your husband's condition. Can you kind of explain how hearing about it impacted you?
Yes, it's true. We were not new to multiple myeloma. Our pastor and good friend, he was not just our pastor, he was our pastor and good friend. We had walked this journey with him a few years before. He had shared with the church that he had multiple myeloma. At that point, I had never heard of it, and that he was going to be gone for a period of time because he was going to have a bone marrow transplant. Never heard of that. The only kind of transplant I had ever heard of was organs. Mm-hmm. And so I was, listening to this. And so we walked through that journey with him. He was gone from the pulpit for 100 days. And during that time, obviously, because we love this man so much, we were all looking it up, researching it. So when we heard in the emergency room that Stan had multiple myeloma, we looked at each other and said, how can this be? It's the same thing Pastor has. How can this be? So we weren't new to it. However, it was no less shocking to hear the diagnosis. And you both are right. Just the diagnosis of cancer, period, is just shocking and frightening, as a matter of fact.
Well, one of the things that I quickly learned about myeloma, for one, when my husband was diagnosed, it was, like I said before, 2005. He was only 35 years old at the time. And it was a couple of years after he had retired from the NFL, where he had played for about 9 years at that point. And so it was shocking to us because here he was, the pillar of health. He was still a relatively big guy, but then he quickly began to deteriorate. And so unfortunately, we lost him in 2010. But one of the things that I quickly learned about myeloma is how differently it impacts people.
Yes.
The treatment options for one person might not work for another. And so I was just curious with both of you, and Christian, you can go first. What was your experience in trying to kind of like navigate watching the person you love go through that whole experience with, first learning and dealing with their myeloma?
Yeah, so looking back at the journey so far, it's pretty different than what I thought it was going to be. To me, my mom's journey does not look the way I would assume cancer looks. That journey looks for most people. And I'm very much aware of the fact that it looks different for everybody. And so her journey has been a lot different than what I imagined it would be, especially after hearing about her diagnosis. To me, prior to going through this journey, cancer, all I knew it was to be scary and, very frightening, and just have this death sentence associated to it, and any visual associations to death. And her journey hasn't looked quite that way, and I'm very grateful for that. I recognize that everybody's journey is different, and so I'm very grateful that her journey hasn't been as frightening as I would have imagined it in the beginning. And I'm, her journey with this has affected me and my family and my other brother greatly, but I could say that because of how strong she's been and the warrior that she has been through this, walking through this journey and watching her go through her treatments and her diagnosis has made it a lot easier.
Well, thank you. And what about for you, Jean? What has it looked like as opposed to, perhaps how you thought it would look like? Is there any difference between the two?
I think, like Christian, Stan's had a good journey to date, and we are very grateful for that. And I think our approach to it was a little different because in our family, as a married couple, we've been married 44 years. We have experienced cancer before. I was treated for Hodgkin's lymphoma in 1989 and 90. And so we saw that there was a positive end. And I think that was what was in our minds. The scary part for me was not so much the cancer. What I was more worried about is how his other underlying conditions, he had triple bypass surgery in 2001. And so how his other underlying conditions might be impacted by this cancer. How would this work together? So I was less afraid about the cancer, and I think I was more afraid about all of it, all of the conditions together. When we found out that he had multiple myeloma, his hemoglobin was very low. His kidney function was getting out of control. They were afraid that they were going to have to put him on a dialysis. They didn't, praise God, that didn't happen. So after we were able to get through and beyond the bone marrow transplant, we've had a pretty even journey. But before that, it was very frightening. For all those reasons I just said.
Right. I can totally understand that. And I think for me, one of the things that I love sharing with people who are currently patients and caregivers is, when Elijah was diagnosed in 2005, there weren't nearly as many treatment options as there are now. And to me, that seems to be a real game changer in giving myeloma patients a lot more options and capabilities of being able to live with myeloma, as opposed to looking at it and immediately thinking, oh my goodness, we need to be planning for doom and gloom.
Yes.
Christian, So in light of learning about your mom's condition, how did that impact you, or how did that change your outlook on things when it comes to just like life in general? Did it make you change in any way?
So of course, her diagnosis changed me, and this journey has changed me. I think I'm more aware of how her daily life is, how little things affect her that I probably wouldn't have been aware of or even thought twice about. Just as simple as going out to run a couple errands on a hot day. So I think I'm more mindful of how she's able to interact with my life and how I'm able to interact with her life, with what she can and cannot do now. I definitely don't think there's been any negative that has come out of this diagnosis for me. You know, I am very grateful that she is still here, and I'm grateful that she has been able to fight as hard as she has so far. I'm appreciative of life more, most definitely, and you know, just looking forward to her being here for more milestones.
That's beautiful. Thank you for sharing that. Jean, I do have a question for you as a caregiver. Did you find easy resources or available resources to provide you all with support? Like, were you a part of any support groups? If you were or weren't, can you explain why?
I thought about support groups. You know, I would see the signs at the James when we would go in for treatment, and I really didn't seriously consider them because I'm certainly not trying to sound arrogant or anything like that, but in my professional life, I've been kind of a person who's been in charge, kind of in charge, and working with other people. And I was having a hard time believing that I was going to find a support group that could meet my needs. I was just really having a hard time believing that I would. I also didn't know if there were support groups out there that really spoke to the needs and the culture of African Americans. I didn't research them. So I can't say, Kimberly, I researched them, I couldn't find them. I wasn't looking because I was just having a hard time believing that these groups would actually meet whatever need I brought to them. I just didn't think it would happen.
So my question to both of you is, the reason why we are having this conversation virtually is because of COVID. We're in the middle of a pandemic, which of course is impacting people with underlying health conditions greater than anyone. And it's a really big concern. How is COVID impacting how you're interacting with your loved one, with your husband, Jean, and with your mom, Christian? Are you all, making sure that people who come into contact with them are washing their hands? Are you trying to make sure you run errands for them so they're not out in the public a lot? Like, how is COVID changing things for you?
COVID has definitely impacted how we interact with each other, how we move around each other, decisions we make, in every aspect. Everything you listed are definitely things that we are thinking about and being cautious of. I am cautious of who I'm around outside of being with my mom. I am cautious around her in general. We have taken measures to make sure that we are keeping her as safe as we possibly can. And it's scary. I mean, there's only so much you can do and so much you can control. And, especially with this being such a fluid situation and not knowing what's coming tomorrow, we're getting recommendations and advice to do one thing, and the next day it might be something different. So it has definitely impacted how we move around each other and interact with each other in the family, but we're doing all that we can to definitely keep her as safe as possible.
And I'm sure my poor husband just would call me Dr. Nag. Honey, do you have your mask? Who are you going to be with? You're not seriously going to that restaurant, are you? Is everybody masked up? Mm-hmm. So yeah, and for all intents and purposes, I mean, seriously, we're still pretty quarantined. I do all the grocery shopping, not because he wouldn't, but it doesn't make sense to us that he would, be out in those crowds. And we do go to church, but our church has been very attentive to making sure that everyone is safe. But we wear masks. We're not around people who are not vaccinated. We're very clear, and I'm very pleased that we were able to. Stan was able to get scheduled for the booster pretty quickly. So I'm pretty excited about that. And then Kimberly, you will laugh, and you too, Christian. I tried to horn in on it. I said, well, I sleep with this man. Can I get a booster also? And they said, no, it doesn't quite work that way. So
that's funny. I totally get it. I don't blame you one iota in trying to make sure that you're doing all that you can to protect him. I remember, when Elijah was diagnosed, our kids were in elementary school. And so it was a big deal for them to come home because little kids are just gross. They're never washing their hands just all over each other with cold. But I also quickly realized how, a cold for a myeloma patient can be very troubling. Like, it just doesn't impact them the way it would someone who has a typical healthy immune system. So I figured that COVID was kind of changing your habits, and I wanted to make sure that we addressed that and acknowledged it. Absolutely. So for either one of you all, do you have any advice that you would give someone who finds themselves in the same position? Jean, with you becoming a primary caregiver for your husband, and Christian, you being the adult child of someone who's dealing with myeloma, and how best to navigate, processing that whole diagnosis. Jean, you can go first.
Sure. What I'd say is, and I know this panel is called the Caregiver panel. I look at myself as a partner with him. Mm-hmm. Because he knows how he feels. He knows what he wants. We want the same thing. He wants to live too. So, it's not me, pushing him to live. But I would say, listen to your partner, listen to your mom, listen to your husband, listen to whomever the family member is. Not only listen to them, about the disease, but listen to their hearts, what it is, their hopes, their dreams, and try to help them get there. Because this is a pretty critical time for all of us. So we're very blessed to be in Columbus, Ohio, with some of the best resources around. And, so for anybody who is not, whatever they can do to get to really good resources. And we're very blessed with that.
I think that's a really, really good point in terms of you indicating the importance of finding good resources. I'll get back to that in a minute. Christian, I want you to go ahead and answer the same question first.
Yeah. So, hearing that somebody you love, especially a parent, being diagnosed with cancer is difficult no matter what age. But I guess the best advice I could give is just because you aren't the one diagnosed with cancer doesn't mean that your journey through this process is no less significant or important.
That's right.
There's no one size fits all roadmap for this journey. And there's going to be ups and downs, and some days are going to be good and some days are going to be not so good. But I think that it's been really important to always remember to not allow fear to shadow those good days, because every day we get, in general, cancer or not, is a gift. And, with somebody who does have cancer, the good days are gems, so enjoy them. And for those not so good days, you rely heavily on your support system. and ask questions. Don't be afraid to ask questions, and allow yourself to feel whatever you need to feel without guilt, because you're allowed to feel how you need to feel, whether you are the caregiver, the patient, the child. You're allowed to have those feelings, and you shouldn't feel guilty about them, and don't feel like you have to be strong and have it together all the time. Give yourself some grace through this journey.
When I say, listen to them, and Christian said it so well that, we're all on this journey together. Sometimes I know I tend to smother, and, it's like, okay, you need to take a nap. You need to do this. We need to listen to what they want to do. If they feel strong enough that day to do A, B, and C, then we need to do nothing but cheer them on to do it. Because just like Christian said, the good days are really good, and the bad days can be very bad, no matter where you are in the equation. But I'm just thinking about, my husband and her mom. And so we just need to cheer them on to whatever they want to do. They're not going to do anything to put themselves in danger. They're not going to do that. But, if they feel like they can get it done, then we need to help them get it done.
I think that's a great spirit to have. I think what ends up being tricky with myeloma, especially if you are on Google too much, is you start to realize the ups and downs of it. And as a caregiver myself, I found myself somewhat waiting for the other shoe to drop. So even when things were relatively stable, in the back of my mind, I always felt like I needed to be preparing myself for something just in case. And I guess we all cope differently. And so it's been great to hear both of you share your perspectives on how you dealt with it. But that's just the up and down roller coaster, I guess, is more a more appropriate word to use. That's just the way myeloma works. And it's frustrating. And it's why I feel like it's really important to not only have these conversations to raise awareness about it, but to do so with the hopes of them eventually finding a cure. Like, that is all I hope for. Even though Elijah is no longer here, I've met so many incredible caregivers and patients and people that just care about the myeloma community in general. And so I just think it's really important that we have these conversations in order to continue making a difference. Yeah.
Christian said something earlier about every day being a gift, and it is so true. I mean, even when I'm at my lowest, Kimberly, I'm thinking, I'm tired. How much more do we have to do? Why can't this be over? So I have to shake myself and say, every day is a gift. It just is. And so it's sometimes it's hard to come to terms with that, but that's the way it is. I can't plan 20 years down the road. I have to plan for every day, the day that we woke up in.
Mm-hmm. Well, I think that's a really interesting point, because it's honestly what still inspires me to this day, in terms of my husband. He was diagnosed with myeloma and still woke up and worked out, or ride his bike. He would go to the gym. And so on days when I wake up and I'm like, I don't feel like going to do anything, I think about him, because it's like, if I have the ability to get up and feel normal and put my body to use and try to just do something, I need to do just that and appreciate what I have here. So I do get your point and totally agree with you. So thank you for sharing that. One more thing I would like to bring up, or at least ask about from both of you, in terms of learning or keeping yourself in the loop about myeloma, to this day. Do either one of you all make any conscious efforts to educate yourself about myeloma? Do you Google it? Do you, read stories, or just try to stay abreast with what's going on with it? Conversations with physicians, or do you just kind of, if you have to deal with it, you deal with it, but until then, you really don't even want to hear the word? How does that work?
At first, I was all about Google, and then I got myself in trouble. So I said, just back up from that. I'm fortunate to be a volunteer with Hicks Harris Ferguson Symposium, and so on an annual basis, which I love. We get the most updated information, which is what's happening right now. Everyone is, has this opportunity for this updated information. And we have great physicians with whom Stan is working. And then we also have a good friend in Dr. William Hicks, who is a retired oncologist who really is not retired for real because he's still all over the country doing all kinds of things. And so, we can ask him questions. We can ask our physician questions. So I stay away from Google and I just go to the experts. If there are things that are puzzling me, that's where I stay because I'm not trained in this area and I can read, and everything on Google is not true. And so, so I just stay away from that kind of thing.
Christian, my question to you is, with your mom being, she has a health background, she was a former nurse, and she's an incredible advocate in the myeloma community. So I know that she's like up to date on all the latest information. So when it comes to educating yourself, do you just kind of wait to hear from her, or do you go on Google sometimes and dig around? Like, how does that work for you?
So I avoid Google at all costs. I do not go looking for information. If I have questions, I will ask her. Google is scary and multiple myeloma is scary enough. So I avoid Google and mainly because I've learned that, one, there's a lot of misinformation on Google, like Jean said, but also multiple myeloma is so different for each person. And we mentioned that earlier. And I don't think even if I went on Google, I could pinpoint what she's going through anyway to find the correct answers. And so to avoid any additional worries or negative thoughts, I do avoid Google and I just ask questions when I have them, or because she does so much advocacy work and she does a lot of speaking engagements, I learned a lot through those as well, just from listening to her share her story and her journey with other people. So.
Well, I'm so appreciative of you adding your insight to this conversation, because when she suggested that we consider the perspective of a child, it had never really dawned on me. And I guess primarily because my kids were so young when my husband was diagnosed. So I appreciate you being so open. And even, we haven't addressed it, but you have a younger brother who you shared. You felt like his experience with myeloma and your mom's diagnosis was a little bit different. Do you want to add a little bit about him?
Sure. So I have a younger brother. He's 3 years younger than me. And when my mom was diagnosed, he was still home. It was his senior year of high school. So he knew before me. And that broke my heart a little bit that I wasn't able to be home with him when he learned about that to support him. But we both cope a little differently. If you're going to give him information, you have to give him the full information, or he's going to worry, or he'll be more concerned. So we both had different journeys through this, but I'm definitely glad that we are able to go through this journey together and that he's not alone in this.
I'm glad that you all do have each other. I think that's really, really important. Well, before we wrap up, I want to ask both of you if there's any information that you would like to share, anything that you would like to encourage myeloma caregivers or the children of myeloma patients, just any insight or tips that you'd like to close out with. Jean, do you want to go first?
The only thing I would say is reiterate something that I said earlier is, just do everything that you can, two things, to find the best care that you possibly can for your loved one. And then secondly, listen to them, listen to their needs, to their wants, to their dreams, because they still have them, and work with them to achieve it. Because I think it will help them, it will help you, certainly helps me, And I'm prayerful that it helps him through his journey also.
And what about you, Christian?
So I'll just reiterate again for any children who have parents with multiple myeloma or any cancer, to go through your journey with grace, give yourself grace, and to definitely remain hopeful. There's a lot being done with research in multiple myeloma. And so just remain hopeful that one day we will get to a point where there is a cure for this.
Well, thank you, Jean and Christian, for being here today. I really love the perspective of a caregiver and someone who is the child of someone with myeloma. You know, it's interesting because when I found myself in the position of being a caregiver, I really didn't even know what that term meant. So you all are a lot more evolved than I was. And one of the things that I do want to reiterate is that when you find yourself in this position, it's really important that you take care of yourself, that you know, if you ever need a moment to just be in solitude, don't feel bad about it. Just, you got to really make sure that you take care of yourself so that you do a really good job of taking care of your loved one. I think that that's really important. And sometimes in the midst of being a caregiver, you can kind of lose yourself because so much of the focus is on the patient, as it honestly should be, but you do have to make sure that you take care of yourself as well. You know, when I became my husband's caregiver, I was 32 years old. I wasn't familiar with the term. And in my head, it was just like, hey, I'm his wife. I'm the mother of his children. It's my responsibility to make sure that everything in this household is run properly, to make sure that he can do whatever it is that he needs to do and be the best patient that he could be. And so just that whole experience absolutely changed me. And even though I lost him, I appreciate the fact that he instilled in me information and experiences that have put me in a position to be able to have conversations with people like you all to help others who are in the same boat. So thank you again for joining us today. Thank you again to the HHF Planning Committee. I hope that we provided everyone with some really helpful information. Thank you.
Mrs. Alexander and panelists, thank you so much for that candid and transparent discussion. You know, when my dad was diagnosed back in the winter of 2008 with multiple myeloma, one of my sisters became his primary caregiver. And what a valuable asset she was to him as he journeyed through calibrating his medicine, going to doctor's appointments, getting treatment and the like, to actually end up having a fairly fruitful 5 or 6 year journey after being diagnosed with the disease. And as you just witnessed there, it does take a strong family network and community to ensure that those diagnosed and recently diagnosed have resources readily available so that the levels of care are there throughout the journey. You know, we're halfway through, and hopefully you are enjoying our program thus far. Make sure you're still keeping an eye on the chat box to see if you are one of the raffle winners. Also, don't forget, you can use the chat box to make comments about the program, the presenters, request more information, and the like. It is now my pleasure to introduce our keynote speaker, Dr. Kenneth Anderson.
Thanks so much. It's really an honor for me to be here today. And I want to tell you about the current and future treatment paradigm in multiple myeloma, in particular, assuring that African Americans share in the remarkable progress. Here are my disclosures. We've had remarkable progress in multiple myeloma. There have been 30 FDA approvals and 14 novel agents. As a consequence, the median patient survival for myeloma affected individuals has been extended 3 to 4-fold. And in many patients, myeloma is a chronic illness. We have the proteasome inhibitors, the immunomodulatory drugs, an HDAC inhibitor, monoclonal antibodies, a nuclear transport inhibitor, a immunotoxin, a prodrug called melflufen, and CAR T cells. And remarkably, several of these were FDA approved even in the pandemic. Now, before I talk about myeloma, I want to mention smoldering multiple myeloma. Many of you will remember that we previously waited for calcium, kidney, anemia, or bone disease complications of myeloma before we treated patients. Nowadays, even when you don't have those so-called CRAB features, we treat patients who have bone marrow more than 60% plasma cells, or an abnormal free light chain ratio, or focal bone marrow lesions. So they get treated with the view of avoiding those sequelae from ever developing. Precursor stage called myeloma that's smoldering can be identified as shown on the bottom of this slide. If you have an M protein more than 2 grams per deciliter, or more than 20% plasma cells, or a free light chain ratio greater than 20, you're at high risk for progressing to myeloma. And the reason I mention that is shown on this slide. In the left panel of this slide are those individuals who are at high risk with smoldering myeloma of progressing to active disease. And what has been tried is lenalidomide as a single agent, 25 milligrams daily for days 1 to 21 of 28 days continuously, to try to delay the progression of smoldering myeloma to active disease. And this study was a positive study. You can see on the left-hand panel that there was a decrease in progression as shown. However, there were associated more secondary malignancies, almost 4-fold increased, and half of the patients discontinued treatment. So treatment of smoldering multiple myeloma is still to follow expectantly. And although lenalidomide can be used as shown on this slide, clinical protocols are also appropriate in this group of patients with smoldering who are at high risk for progression. Now, another major advance in myeloma is our ability to achieve and also to measure what's called minimal residual disease. Fewer than 1 tumor cell in 100,000 or 1 million normal cells. And on the left-hand side of this slide is shown the progression-free survival advantage when you achieve MRD negativity, either in newly diagnosed transplant eligible or ineligible patients. And in fact, on the right-hand side is the overall survival advantage. And again, you can see that achieving MRD negativity confers a benefit in PFS, in OS, in newly diagnosed myeloma patients, and also in those who have relapsed refractory disease. Now, here's a menu that I've made that you and I can use when we see newly diagnosed myeloma transplant candidates. And I won't go through all of it, but 3 drugs are common. For example, lenalidomide, bortezomib, and dexamethasone. What's new is, as shown in the middle of this slide, is the addition of daratumumab to the lenalidomide dex Velcade regimen, so-called RVD-DARA. And it's shown on the bottom of this slide, the ability to use maintenance, lenalidomide maintenance, for example, in standard risk, or incorporating bortezomib or daratumumab with lenalidomide in the high-risk patients. So let me show you on this slide a study that we've carried out when we utilize this 3-drug regimen, lenalidomide, bortezomib, dex, so-called RVD, with or without an early transplant. In the upper left-hand side, the extent and frequency of responses increased when, in fact, RVD is followed by an early transplant. What's so remarkable is the ability to achieve minimal residual disease negativity, which is high whether you get a transplant or not. And shown in the lower right-hand section of this slide is the fact that if you achieve MRD negativity, shown in the red here, that the progression-free survival and overall survival is superior. This is how remarkable this RVD transplant and maintenance paradigm is in terms of extending life. This is an experience from the Emory Winship Cancer Center, where patients got RVD, transplant, and then risk-adapted maintenance. lenalidomide for the standard risk, and lenalidomide and bortezomib for the high risk. You can see on the left that the progression-free survival for the standard risk patients is 76 months. And on the right, the overall survival median has not even been reached, with a follow-up extending out here to 140 months. So in many patients, especially those with standard risk myeloma, we can actually have a chronic illness utilizing this kind of a strategy. Now, I mentioned that the incorporation of CD38 antibody called daratumumab is now becoming standard practice in the initial treatment of patients with myeloma. Here is the Griffin trial that I referred to earlier. It's daratumumab RVD before and after transplant with daratumumab lenalidomide maintenance versus in a randomized trial RVD before and after transplant followed by Revlimid maintenance. And the reason it's becoming standard practice in our disease is shown on this slide. This is the chances of achieving MRD negativity, fewer than one myeloma cell in 100,000 normal cells. And on the left-hand section of this slide, you can see the MRD negativity percentage increases up to 2/3 of patients when in fact daratumumab RVD is used, where it's only 30% when RVD is utilized. So daratumumab RVD as initial treatment for the newly diagnosed transplant candidates. What about the older patients with myeloma or those who don't have liver, heart, lung, or kidney function that would make them eligible for a transplant? Well, here we use the same kind of triplet regimens, lenalidomide, bortezomib, dexamethasone, but we attenuate the doses. We call it RVD Light, sort of like Bud Light or Miller Light. We also incorporate daratumumab, and shown in the center of this slide is daratumumab lenalidomide dex, which is commonly used now to treat the newly diagnosed non-transplant candidate. Here I've put on one slide the different regimens that have been used to treat newly diagnosed patients who are not transplant candidates. They include the RVD Light here, and the Maya trial is shown, which was daratumumab lenalidomide dex versus lenalidomide dex in newly diagnosed myeloma. And in fact, what's true in this slide is that the progression-free and overall survival now are superior when you utilize daratumumab lendex versus lendex. So this is becoming the most common regimen that we use to treat newly diagnosed non-transplant candidates. And I want to just stress how important and how major the advances have been, because this particular slide shows you a meta-analysis done when daratumumab is added to the initial treatment of patients with myeloma. And this is in particular in patients who have high-risk disease, for example, 17p deletion, multiple myeloma. What's shown on this slide is if you add daratumumab, you can confer remarkable benefit even in those patients with high-risk disease. So very major advances and a really important evolution in the transplant treatment paradigm. Now, what happens when myeloma relapses? Well, you and I, when we see patients, think about many factors. We think about frailty. Are they fit or frail? We think about disease morbidity. Do they have renal disease? Do they have neuropathy, for example? We think about their risk assessment genetically. Is it standard risk or high risk? But perhaps more importantly are the last two factors. We think about what prior treatment the patients have had, and we think about their lifestyle and what's really the goal of therapy. And usually with all of these factors in mind, we can, together with our patients, think of the most appropriate effective regimen for each and individual patient. So here's a menu I've made of, similarly, as I showed you for the newly diagnosed patients, here it is for the relapsed myeloma patients. And as was true for the initial management, so it's true here, we like to use 3 drug regimens in combination. And it depends on what the patient has had before. We have triplet therapies that are active in patients whose myeloma is refractory to bortezomib. We have triplet regimens used in patients whose myeloma is refractory to lenalidomide. And at the top of this slide, remember I've already mentioned that lenalidomide, bortezomib, dexamethasone, so-called RVD, is commonly used as initial treatment. Well, even in patients whose myeloma relapses and is refractory to lenalidomide, bortezomib, dex, or RVD, we have a variety of triplet FDA-approved regimens. And then at the bottom of this slide, we have a variety of agents that were FDA-approved even in the pandemic. And these are active even in what we call triple class refractory. That means refractory to immunomodulatory drugs, proteasome inhibitors, and CD38 antibody, or even in penta-refractory myeloma, which means lenalidomide and pomalidomide refractory, bortezomib, carfilzomib refractory, and daratumumab refractory. And these agents are the nuclear transport inhibitor selinexor, the immunotoxin belantamab mafodotin, the prodrug melflufen, and CAR T cells, all of which were recently FDA approved. So let me just go through this very briefly. This particular slide shows you the agents that are available as choices in patients whose myeloma is refractory to lenalidomide. These clinical trials compared bortezomib dexamethasone with bortezomib methazone added to pomalidomide or added to daratumumab or added to carfilzomib, added to selinexor or venetoclax. The point of this is the 3 drug regimens were more active in each case, and in the red box on this slide, the progression-free survival hazard ratio was in favor of those 3 drug regimens. So we have a variety of agents from which to choose in patients whose myeloma is refractory to lenalidomide. This is the converse. If your patient presents with myeloma that is refractory to bortezomib, there are a variety of choices based on the trials shown on this slide. In this case, lenalidomide dexamethasone was the control arm, to which was added the oral proteasome inhibitor ixazomib, or the monoclonal antibody elotuzumab, or the proteasome inhibitor carfilzomib, or the monoclonal antibody daratumumab. And in each case, in these phase 3 randomized trials, the triplet therapy was superior. Again, in the red box, the progression-free survival hazard ratio was remarkably in favor of the triplet regimens. So again, multiple choices from which to benefit in patients whose myeloma is bortezomib refractory. Now, what about those patients who actually have bortezomib and lenalidomide refractory myeloma? So on the left, we have summarized a variety of slides that are based on pomalidomide, the 2nd generation immunomodulatory drug. And for example, pomalidomide dex has been compared with elotuzumab pomalidomide dex, or the monoclonal antibody isatuximab pomalidomide dex, or the monoclonal antibody daratumumab pomalidomide dex. And in the dark blue bars on this slide, you can see that the progression-free survival is in favor of the triplet therapies again. On the right-hand slide is, in fact, a similar experience This time, it's using the second-generation proteasome inhibitor carfilzomib dex, to which is added daratumumab, CD38 antibody, or isatuximab, CD38 antibody. And in each case, the blue bars again show you a remarkable increase in progression-free survival. So the point here is that even when myeloma relapses, if we take into consideration the personal characteristics and the treatment history, we have multiple choices that can confer months to years of quality survival in our patients with myeloma. Now, during the pandemic, or in spite of the pandemic, we had several approved agents in myeloma. One of them is the nuclear transport inhibitor selinexor. As shown on this slide, selinexor bortezomib dexamethasone in a randomized trial was compared with bortezomib dexamethasone in patients who have 1 to 3 prior therapies and relapse disease. On the left is shown the progression-free survival advantage when selinexor is added to bortezomib dex. And on the right, this advantage was shared in fact, all subgroups of multiple myeloma. The other remarkable agent in multiple myeloma is venetoclax, the oral BCL2 inhibitor that many of you know is already FDA approved in leukemia and lymphoma. And what's shown on this particular slide is that in those patients who have 11-14 translocation myeloma or high BCL2, the left-hand panel of this slide, the combination of venetoclax BCL2 inhibitor together with bortezomib confers a major progression-free survival advantage. But that advantage is not shared in the patients with myeloma who do not have 11-14 or BCL2 high expression. Now, I want to just mention and finish our little introduction of the current treatment of myeloma with the other 2 agents that have been FDA approved during the pandemic. Melphalan flufenamide, or which is known as melflufen, is a drug conjugate. Think of it as a prodrug. It's given IV and it goes to the myeloma cell. It's converted in the myeloma cell to melphalan by an enzyme called aminopeptidase. And the simple concept is to try to get higher concentrations of melphalan in the myeloma cell to, in so doing, improve the efficacy while at the same time decreasing the side effects and improving the therapeutic index. Now, this agent was FDA approved because of a response rate of about 30%. It is going on now in future randomized phase 3 trials in combination with other agents as well. We have one BCMA immunotoxin now approved in multiple myeloma, and that's shown on this slide. It's called belantamab mafodotin. It's a BCMA monoclonal antibody, which has immune activity against myeloma. And as a second mechanism of action, it delivers an immunotoxin, mafodotin, to the myeloma cell. So there's an immunologic and an immunotoxin-mediated cell death. And shown on this slide, in the left column, the 2.5 milligram per kilogram dose, there was a duration of response of 11 months and a response rate overall of 31%, which is the basis for the FDA approval of this treatment. It has an associated keratopathy leading to visual changes. So with each dose of this immunotoxin, there is a preceding ophthalmologic evaluation which is required. And then finally, I'll mention that during the pandemic was approved CAR T cells in myeloma. I think you're all familiar with CAR T cells. The concept that you harvest T cells from the patient, they outside of the patient are then transfected, and in our case, with a FAB region recognizing a myeloma antigen, whether that be BCMA or GCPRC5D, for example, on this slide, the cells are activated ex vivo with the constructs such as demonstrated on the left here, activating the T cell receptor and including co-stimulatory molecules. You expand these cells into large numbers, and then you transfuse them back to the patient, as I like to say, as their own immune army. And shown on this slide are the various CAR T cell therapies in myeloma, highlighting the leftmost column, which is the FDA-approved ide-cel product. In patients who literally have no other options, this particular CAR T cell project achieved 73% overall response rate. The duration of response was about 11 months. And in fact, the progression-free survival about 8.6 months. At a dose of 450 million cells, which is the recommended dose, the response rate was better at 81%, and the duration of response was better at nearly a year, as was the progression-free survival. The second column is the cilta-cel product, and this is likely to be FDA approved in the near future. They had a very high response rate of 97%, 2/3 of them being complete responses. And here the durability was longer, approaching 22 months, as was the progression-free survival. Finally, there's what's called bispecific T cell engagers. And this, in plain and simple English, is in fact a medicine which on the one hand binds to BCMA on the myeloma cell, and on the other hand binds to CD3 on T cells and brings the T cells, as shown on the right here, to the tumor cells, in so doing to enhance the activity and again, avoid side effects. And in a similar fashion, here is a table with all of the bispecific T cell engagers, which are known as BiTEs, that have been studied in multiple myeloma. And you can see there are multiple agents, mostly targeting BCMA, but some targeting other myeloma antigens, GPRC5D or FCRH5, for example. because in so doing, we can prolong not their life by months to years, and they can have quality survival. And I mentioned novel treatment approaches, the BCMA-directed immunotoxin or bispecific T-cell engagers or CAR T cells. What I really want to highlight is on this last slide. African Americans have been underrepresented in clinical trials, but when they're included, their outcome is the same or better than other patients. So we need to join in the multiple efforts that are ongoing to overcome the obstacles to African American participation in clinical trials. For example, setting goals right from the outset, real world trials. You see, ultimately solving the problem of African American accrual to clinical trials will not only improve their outcome, but it will also serve as a paradigm for new drug development more generally. In other words, if we include patients in clinical trials, which are reflective of the patients we treat in the real world, we will learn in our clinical trial structure the efficacy on the one hand and the side effect profile on the other. And so we will know from day one after a new drug is approved what to expect in all patients. I've mentioned this slide previously, but I just want to finish with it. In myeloma, the best is yet to come. We can achieve MRD negativity with induction. We're going to use our BCMA immunotherapies right after induction. And we are going to then have long-term disease-free survival and, dare I say, a potential cure if we do, in fact, the induction and then confer an immune reaction against myeloma in patients. And at the bottom is most important. African Americans and all patients will then be able to share in the benefits of novel therapies. And finally, this is my research team on the left and my clinical team on the right, and it's called the United Nations Against Myeloma. I've been blessed over many years to have investigators and caregivers from all over the world, many of whom are now the myeloma leaders internationally. And the benefit of that is that the advances that we have described and hopefully the progress in African Americans that is to come will be shared not only and led by investigators in North America, but hopefully we can spread the advances and the patients worldwide will benefit from this progress. I do want to, again, thank you ever so much for this honor. I think the message that we have hope and we have the gift of life should be highlighted here, and in particular, the opportunity to benefit African Americans in particular has never been greater. Thanks ever so much.
Dr. Anderson, thank you so much for that outstanding presentation. We so appreciate you sharing your knowledge and expertise and bringing additional focus to these areas. New treatments for newly diagnosed patients, how transplants for newly diagnosed improve response rate, therapy treatments for relapsed patients, and most importantly, addressing the importance of including and increasing the number of African Americans in multiple myeloma clinical trials. So much has been accomplished, yet there is still much more that needs to be done. We so appreciate your dedication and your steadfast commitment to research, treatment, and eventually what we all hope will be a cure for this disease. As we approach our final session, please check the chat box for our final chat raffles of the day. Now to our last session, Building Your Immune System During Treatment with Mrs. Michelle Lights.
Thank you, Clark and the HHF Planning Committee. It is my pleasure to return and present to you, especially during this 10th annual Hicks, Harris, Ferguson Multiple Myeloma Symposium. Building your immune system is key, and understanding the nutrients that are essential to your body is very important to help you get through and manage myeloma, as well as the side effects of the treatment. Today, I want to share some objectives. My objectives today are to understand the nutrients that protect your immune system, identify foods that support your immune system, learn food safety tips for a compromised immune system, and also do a few quick, healthy snacks that anyone can make. Multiple myeloma is a type of cancer that originates in the blood or the plasma cells, and that's in the bone marrow. Under normal circumstances, they're involved in your immune defense system, which helps us fight infections, and it builds antibodies that help us kill germs. During the course of the disease, patients go through multiple cycles of remission and relapses. And that's why it's critical to understand what foods you need to help fight back, keep your immune system as healthy as possible so that you can really be in the fight. Do you know that once you are diagnosed with cancer, you are considered a survivor? Well, when I thought about survival, when I knew that little tip, it made me think of my favorite show, Survivor. And that's because the contestants on Survivor are put through multiple obstacles. They must work together as a team to go through the challenges that they have, and they each bring their own set of skills to the game. Now, I work with cancer survivors every day, and I feel that cancer survivors have their own set of skills as well. First, they come in and they are knowledgeable, but they also have the capacity to learn more about how they can manage this new chronic disease. And that's critical. Like the game show, my patients also have to form alliances. And those alliances are very crucial to helping you get through the treatment. You form alliances with your healthcare providers. That would be your physician, the nurses, the pharmacists, and even your dietitians. It is key to form those alliances to help you get through the treatment. Another skill, I believe, that the cancer patient has is that they have to have the strength and the perseverance to get through the tough times. Now, one of the biggest difficulties and challenges is when you are not nourished well, okay? And so today, we're gonna learn what it takes to help you get nourished. Like on the show, the cancer survivors are looking for immunity, and that immunity idol. This is our immunity idol. I'm hoping you can see these are my fruits and my vegetables, and I wish that I can wear them for you just like this. But immunity is key, and we're going to let's talk now about those fruits and vegetables that are going to help keep us safe. All right, put these down. All right. Now, when a multiple myeloma patient is in crisis, there are a few things that are actually going on in the body that are very nutrition related. And there's an acronym that's used to describe these specific symptoms. The acronym is OLD CRAB. Now, I know that was really funny to me, but myeloma patients, the older the patient is, or the more mature, I should say, the longer the disease has progressed, then you may have these issues. So the acronym for CRAB, CRAB, the C stands for elevated calcium levels. Sometimes the calcium can just leach from the bones, and it's in the bloodstream at that point. So we don't want those elevated calcium levels, but it's definitely one of the things that can happen. Another thing is renal failure or kidney problems. When the blood levels are elevated, the kidneys have to really work hard, and they can get damaged in the process. So kidney failure or kidney problems is another issue. And then anemia is another. And anemia can be related to some of the nutrients. Maybe you have a nutrient deficiency in iron, B12, or folate. Another issue that happens when you're in crisis is that there can be bone fractures. There can be lots of bone pain as well. So it's important for you to understand what you can do from a nutrition and a diet standpoint to shore up your immune system. So let's talk about some of those key nutrients now. So the main nutrients that we need to help shore up our immune system are things like vitamins and minerals. It's important to know that vitamins and minerals we need in small amounts, and they can be found in the foods that we eat. One of those nutrients is iron. Iron helps us transport oxygen to our tissues and to our cells. And also, if you don't have enough, it's the one thing that makes us so tired. There's also nutrients like B12 and folate. Now, these particular nutrients help us build those red and white blood cells. When the doctors are checking your blood, they're looking to see what are your blood cell levels. And if they're too low, again, that's another part of this disease that makes it a little bit more immune compromised. Now, vitamins A, vitamin C, and vitamin E. I like to remember the card, like the ace of spades, vitamin A, C, and E. These nutrients are antioxidants. Antioxidants get into your body and they basically coat your cells and they protect them so they don't oxidize and break down. And that's what we want. Zinc is another nutrient that is very helpful in repairing your cells. Vitamin D is extremely important. Now, what I love about vitamin D is you actually can make vitamin D in your body if you are exposed to a little bit of sunlight. And you can also get vitamin D from foods. But vitamin D helps to regulate the amount of calcium and also the amount of phosphate that's in the body. Now, this is one you may not have heard of before. Uracilic acid. And this one is key for multiple myeloma patients. It helps to increase the bone mass, and it also inhibits cancer cell growth. Now, I always like to talk about vitamins and minerals because sometimes people want to overdo it on vitamins and minerals, and we really don't want you to do that. Understand that you may have to reduce certain nutrients because the amount of damage that can be done to the kidneys may make it difficult. So, for example, sodium, potassium, as well as phosphorus may need to be lowered during your treatment. So again, your blood levels are going to be monitored by your healthcare team. Supplements can be necessary, but ultimately we'd like you to get the nutrients you need from the foods that you eat. That's the best way to do it. Okay? Before you decide to take a supplement, it's important for you to talk with your doctor and or your registered dietitian before you start them because they can definitely impact the treatment that you're undergoing. All right, let's talk about some immune boosting foods now. This is the most important part because I love to eat and I know you do too. So we want to do everything we can do to help shore up that immune system by the foods that we eat. In order to get iron, what are some good sources of iron? So this picture that you see here has a wide variety of foods. And that's what's important, is to eat a wide variety of foods because all of the foods that we eat contain these nutrients that we need. Iron you can get in things like oysters, chicken, turkey. You can also get it in non-meat sources like lentils and beans, peas. Fortified cereals are also going to have iron in it, as well as your whole grains and enriched breads. So again, we can add nutrients to the foods that we eat, and that's what you want to look for, the ones that give you enough of the nutrients you need to support your immune system. Now, where do you get folate? Folate is going to be in things like asparagus, black-eyed peas. Yes, I'm from the South, so I definitely want to incorporate those black-eyed peas. Beans, lentils, as well as spinach. So any dark green leafy vegetable is helpful. So look for those, figure out how we can incorporate them into your salads, side dishes. Another big nutrient is B12. Now, B12 only comes pretty much from animal products, or it's the most readily source of B12. So things like beef, even liver. Oh my gosh, you know, my mom's been trying to get me to eat liver all my life. With a little ketchup, I can do it, but it's a great source of B12. So with fish, eggs, cereals, milks, and nutritional yeast if you are more plant-based. Now, we are talking about these nutrients because we want you to eat more fruits, more vegetables, more whole grains. And so the vitamins that we're talking about now, the vitamin A, the vitamin C, the vitamin E, the antioxidants, they are all in the fruits and the vegetables that you eat. When you think about vitamin A, I want you to think about the color orange or the deep yellows, because the deeper the color, the more nutrients the foods have. So vitamin A sources are going to be things like sweet potatoes, pumpkin, carrots, mango, milk, and also ricotta cheese. All right. Now, for that vitamin C is extremely important to multiple myeloma patients because vitamin C helps you absorb iron. So when you're eating your meal, you want to have a meal that has good protein sources in it. And then if you have a glass of juice or another source of vitamin C on your plate, it's going to help you absorb that iron. Okay, so that's very important. Vitamin E, you're going to find in things like salmon, and you're also going to find it in sardines. Now, sardines is also going to give you, when you eat the bones, you're also going to get a little calcium from there too. Other things that you're going to get for vitamin D that you can get from would be your mushrooms. Zinc, as I mentioned, you need the zinc for healing. Shellfish, so if you like shrimp, crab, if you like legumes, like beans, peas, and lentils, your seeds and your nuts also are going to provide zinc. You don't need a lot of the nutrients, and that's why we don't want you to supplement. We want you to get it from the foods that you eat. Remember, all of the foods that we eat, the deeper the colors, the more nutrients they have in them. Now let's talk about that uracilic acid. Now that's going to come from things like some of your seasonings. So that's how you bring in the seasonings as well. So basil, and we're going to be doing a recipe that includes basil today. Rosemary, turmeric, cranberries are great sources of the uracilic acid. And remember, that helps shore up your bones. Very, very important. So next, I have a slide for you that just gives you 74 different foods that are anti-inflammatory. Now, again, we believe that when you eat, you're trying to keep the inflammation of your cells down, because we feel when the cells are inflamed, that's when they break down and can turn into cancer and things that we don't want. So we want to make sure that you're eating foods that are anti-inflammatory. And there's 74 examples, and this is not all of them. But as you can see on this list, you can get anything, pretty much any fruit, any vegetable you can name, even meat, even your herbs are on there. So you've got beef, you've got chicken, you've got rosemary, you've got oysters. There are lots of different foods to choose from. And what I love about our country is that pretty much you can eat these foods all year long. You can get to the grocery store. You don't have to have your own garden, which I have my own garden, and that's a wonderful way to get those fresh nutrients in season. But in this country, we can get the nutrients from the foods that we eat all season long. So when you have an immune compromised situation, that means those blood levels are down. Perhaps they're talking about postponing treatment. It is important that you protect your immune system by the foods that you eat and also how they're prepared. There's some things that we want you to avoid when those blood levels are low, because we don't want you to introduce anything that your body is not going to be able to fight off. So there's some foods and some things that I want you to avoid, such as raw meats. Now, if you're a tartare kind of person, or even a sushi kind of person, those foods are great under normal circumstances, but when you're immune compromised, they can have bacteria in there that your body just may not be able to fight through. So for those reasons, we're going to avoid that. Another thing that we might avoid are going to be some cheeses. So any cheeses that have mold in them, like I love a good Roquefort or Stilton blue cheese, but they have mold in them. So again, under normal circumstances, that would be fine, but when you're immune compromised, you want to avoid that. I'd also suggest that you avoid some deli meats. Also avoid leaving foods out in what we call the danger zone. When it comes to the holidays, sometimes you make that meal and it's at 12 o'clock, you want to eat, but then you want to come back at 4 o'clock. If that turkey has been sitting out with all of the dressing and all of those things, and you come back to it, the immune compromised person runs the risk of introducing bacteria that they just can't fight. So make sure that the foods are cooked to an internal temperature, proper internal temperatures, and also make sure that you don't leave your leftovers out. Be very mindful of things like mayonnaise. You know, it's terrible when you go on a picnic and you have mayonnaise and you can see it. Again, when it changes that color, it just means that it's potentially harmful to you when you're immune compromised. When you're actually cooking and you use your cutting boards, try not to cross-contaminate on the cutting boards. Try to ensure that you're also eating pasteurized milks, not raw milks, but pasteurized milk. When you pasteurize the products, basically what you're doing is putting it through a heating process. So you're killing the bacteria and again, reducing your risk of getting an infection. Eggs are another food that can be a little dangerous when you're immune compromised. As long as you're boiling those eggs, that's fine. But again, if you are eating eggs that are slow cooked or soft cooked rather, be real careful about that because again, you run the risk of getting salmonella and that's not what we want when we're immune compromised. So now that we've heard all about these great foods, I promised that I was going to show you how to do very easy recipes. Now I've got 2 recipes that I'm going to share with you. The first one is called peanut butter energy balls. And the reason that I'm sharing the peanut butter energy ball recipe with you is because, again, sometimes we're just tired. The recipes that I've chosen today, number 1, don't require any cooking. The other thing is that there are only 4 ingredients. So it's fast, it's quick, it's easy, plus it's providing the nutrients that you need. So let's step over and look and see what we're doing here. Now, remember, the peanut butter energy ball recipe has 4 ingredients. I'm using a reduced fat peanut butter, but you could certainly use your regular peanut butter. You could certainly use a little crunchy peanut butter, but the peanut butter is actually a great source of nutrients as well as protein. So protein is what we need to regenerate new cells. Now I'm going to also put in a little bit of local honey. So I put in 1/4 of a cup of the peanut butter, and I've got 1/4 of a cup of the honey. This is local honey. The other thing that makes this recipe great is that it has powdered milk in it. So I've got about 1/2 cup of powdered milk. Now protein from the peanut butter and from the powdered milk this recipe is like making your own protein bar. So you don't have to go out and buy one when you can make it all yourself. Last but not least, we're going to add a little bit of corn flakes. But before I do that, I'm going to go ahead and stir this up because I want you to see what the consistency is supposed to look like. This is really easy to do, and I have to tell you, this is not just for cancer patients, it's also for anybody in your family. I make these recipes, this particular recipe, for my daughter's soccer teams, and I am the snack mom of the year when I bring these. It truly does give them a little bit of energy, and it'll give you some energy too. So as I stir this up, it kind of looks like sand because you're just trying to incorporate the powdered milk in here. Now, what sometimes I'll have to do is use my hands, and it helps you to kind of get down and dirty with it when you can just kind of stir it up and use your natural utensils. And I'm calling my natural utensils my hands. So I don't know if you can see this, but for the most part, what you have here, it just kind of looks crumbly. And then what I'm going to do now is add the cornflakes. Now, if you're having issues like side effects such as constipation, you may want to add some bran flakes because the bran flakes add fiber. All of the foods that we just talked about are going to add fiber. So if you're having issues with elimination, add some bran flakes. Today, I'm actually using corn flakes. If you are having issues with the other side, diarrhea, that's another common side effect then you can use cornflakes because you're decreasing the amount of fiber. But in general, we want good fibrous foods, and that's what you're going to get when you eat the fruits, the vegetables, and the whole grains. Now, again, I told you I'm going to kind of get down and dirty with this and just use my hands here for a minute. And I'm just going to crunch it all up so that I can get my cornflakes incorporated. Now, again, you have to make sure that your hands are washed and cleaned before you do this process because you don't want to introduce any unwanted bacteria. Now, I find that the oils from the peanut butter, you could also use almond butter. So some people don't like peanut butter. You can use almond butter. It's still extremely healthy. Now, the only thing you can do now, once it's like this, is make it into little balls. So I just grabbed a piece and I'm basically kind of crunching it in my hand so that it looks like a ping pong ball. And I just roll it like this. And then I can put it on my little plate. I'm going to do one more for you. So you can see, I'm just kind of rolling it. And now I've got my little ping pong balls. Now this recipe makes about 8 balls, 8 protein, high calorie, high protein balls. In fact, when I say high calorie, two of these balls has about 220 calories, which is almost the same number of calories that you would get in an Ensure, an original Ensure, or an original Boost. I think you have to ask yourself, would I like to have peanut butter energy balls or would I prefer to have an Ensure? Here's my recommendation. If you're needing calories, do both. Eat the peanut butter energy balls and wash it down with another high protein shake. And that's in itself like a meal. So you don't have to eat so much if you're having difficulty with your appetite. This would be a great snack. Now I'm going to take a break in just a second to wash my hands, but I wanted to show you the finished product. So these are my peanut butter energy balls. The last thing you have to do with this to make them look this way is you take about a half a cup of your cornflakes, and I like to put them in a bowl, or you can put them in a plastic bag. And then you just kind of roll them around in the plastic bag until you kind of encrust the outside. And it just makes it nice and crunchy. And that's pretty much what you have. So I'm going to put these down like this. Now, I do like to kick it up a notch. And every once in a while, what I'll do is add a little bit of chocolate to it. So it's like peanut butter and chocolate. Again, if you are diabetic, you may have to change your diet around a little bit. Maybe the diabetics won't do the chocolate, but they can still do the peanut butter energy balls. I would also make sure that you are not doing fresh peanut butter that you're grinding at the stores, because again, you may run the risk of introducing some bacteria that you don't want. So the regular peanut butter is perfect. So I'm using a little bit of Magic Shell for those of you who want to do it. Pour it on, pop it in the refrigerator, and then it's going to make a nice hard crust. So I'm going to wash my hands now, and then we'll get on to the next easy recipe. Now, I promised you 2 simple, easy, flavorful recipes. The next one we're going to do is called salad on a stick. And it's very simple because it only has 4 ingredients. We're going to use cherry tomatoes, and these cherry tomatoes are chock full of vitamin A, vitamin C. They also have some fiber in them as well. We're going to be using fresh basil leaves. Now, fresh basil leaves have a great source of iron, plus they are very flavorful and they have that uracilic acid in it. That's very important for the myeloma patients. Now, I will say on the basil, if you're interested in making a wilted salad, you want to make sure that you cook it in just a little bit of maybe the cast iron skillet. You actually absorb some of the iron from that skillet if you were doing a wilted salad or even a side dish with your leafy green vegetables. What I want you to know too is that I've washed these thoroughly and I've dried them with a paper towel because again, we don't want to introduce any bacteria if your immune system is compromised. The other thing we're using is mozzarella balls. And I just bought these from the grocery store, but they're in perfect little balls. And We're going to put a little bit of Italian dressing as well. You don't need a lot of Italian dressing, but it's nice to just kind of marinate it. It just adds a little bit of flavor. Now, I'm putting my toothpicks are my sticks. If you want to have a longer stick, that's fine, because then you can put more, and you may even use some yellow tomatoes or other vegetables on there, and it makes a really, really fun bite. But I'm going to put a little bit of cherry tomato on there. Now I'm going to take one of my basil leaves, and I'm going to basically fold it in fourths. And again, it's going to give it a nice flavor. Basically, this is a caprese salad on a stick. Last but not least, I added my mozzarella, and I'm going to put it into a plastic baggie. And when I put it in a plastic baggie, you can either put it in a baggie or you can put it on a plate. And I'm adding just a little bit of Italian dressing to it as the marinade. And I like to massage the bag or put it in the refrigerator for about 20 minutes. I've even left them in overnight. It makes them even better. But it may wilt the lettuce or your green on there. But it's a wonderful, easy dish to make. Now I've laid them out so that you can see them, and I think they're beautiful. It's perfect for the holiday time, and it's the perfect one bite. I can actually pop the whole thing in. To decorate it, I'm also using just a little bit of Italian dried herbs. Remember we talked about those anti-inflammatories? Oregano is one of those anti-inflammatory herbs. So again, try the turmeric, try the oregano, try the rosemary. That may be helpful to flavor your food, and then you can avoid some of the salt as well. All right. So there you have it. 2 very simple, easy recipes that I hope you try that are going to definitely help boost your immune system and give you the nutrients your body needs to fight. I want to thank HHF for the opportunity to share this experience with you. I hope you have a wonderful symposium, and happy eating to all. Take care.
Mrs. Lights, thank you so much for sharing that invaluable information on the various nutrients and foods that boost and support our immune systems, and most importantly, the food safety for those with compromised immune systems. I think these resources are something that we all can benefit from. You know, we also appreciate the healthy snack demos, and for our audience now, the recipes are in the symposium program. I'm sure all of you may be ready to run out and see if you've got those ingredients either in your pantry, or you're going to head to the store to see if you can actually make those peanut butter energy balls and the salad on a stick. That would be an investment well worth your time and energy if you do so. I know me and my family are going to be on that for sure. Up next, as we end this awesome symposium, we have Dr. William Hicks, co-founder and member of the Hicks-Harris-Ferguson Planning Committee, for closing remarks. He'll be followed by the Reverend Roderick Reed, Senior Pastor, Mount Vernon AME Church in Columbus, Ohio, for our closing prayer. And before Mr. Hicks comes up, I would like to say what a pleasure and privilege it's been for me to serve as MC for this informative, encouraging, and uplifting symposium.
Good afternoon. And on behalf of the Hicks-Harris-Ferguson Multiple Myeloma Symposium, we thank you and appreciate you for spending this time with us today. When the late Cheryl Boyce approached me about creating a community event to increase the awareness of multiple myeloma, I never imagined we would be celebrating our 10th annual event. In 2010, we had approximately 30 people, and over the years, it's grown to reach hundreds from around Ohio and surrounding states who are eager to learn about this disease that affects disproportionately communities of color. We do appreciate your continued support for this symposium. Again, I want to thank all of our speakers, presenters, and panelists for their gracious sharing of their time, talents, and stories with us today. Although a practicing oncologist, I continue to receive a wealth of new information and inspiration from this symposium. It was very important to Cheryl that we continue to put a national face on this disease to better advocate and support those affected with this disease. Finally, the Hicks-Harris-Ferguson Committee would like to thank our sponsors and supporters, especially our long-term partner and gold sponsor, Amgen. We greatly appreciate your continuous support for the symposium. We are wishing you a very blessed rest of the day, and we hope to see you in person at the 2022 symposium.
Let us pray. Eternal and all-wise God, we come before you thanking you for your great grace and your loving mercy you have shown to each of us on this day. We thank you for this time of fellowship and learning as we have gone through the symposium, turning our faces towards those affected by multiple myeloma. God, as you have said through your word and through your apostle Paul to the people of Corinth, that one is to plant, another is to water, and you would give the increase. I pray today that you bless the seeds that have been planted by these wonderful presenters, that their seeds of knowledge find good ground to root and to grow. I pray that their seeds be watered by the ears who have heard and the eyes which have seen through this symposium as they continue their advocacy against this cancer. And after the seeds have been sown and watered, we are entrusting the increase of healing by your divine hands. We pray that the healing of each body that this terrible cancer has found its way into. We pray for healing for the mind, that each person affected may find joy for today and bright hope for tomorrow. We pray for the healing of emotion of those who have lost loved ones and still water the fibers of their pillows each night. Comfort ye your people, O King. Turn each cross into a crown. May our souls find rest in thee, our feet on higher ground. Bless us now from this symposium, but never from your presence. In the name in which our healing is secure, in Jesus' name, amen.